right. So, all right. Well, hello, everyone. Thank you once again for joining our call tonight. And at this time, we have a disclaimer that we want to share real quick. All righty. Okay. So we are not here to diagnose any medical problems. However, this site is for informational or educational purposes only and does not substitute professional medical advice or consultation with a healthcare professional. And so at this time, we're going to go ahead and do our company motto. And Uncle Mike, you could take it away.
All right, thank you very much. Would like to say good evening to everyone. Want to welcome everybody to our Tuesday night call. I'm going to demonstrate first how we do the company motto. I will say company motto, are you ready? We'll raise our fists and say yes. And then I'll say go. Cherish the spirit, create the vision, follow the faith, serve in humility, Aja, Aja, Aja. Okay? All right, everybody unmute, everybody unmute. And after we do the company motto, please put yourself in mute. Okay, all right, with that being said, company motto, are you ready?
Yes.
Go!
Cherish the spirit.
All right, thank you very much. Back to you, Sales Master Sharon Wilson.
All right, thank you so much for that. Well, guys, we are super excited. We are so fired up. We are so excited to share with you about this great, great company. And I'm telling you, we just got out of a meeting, so we're all excited. So we want to take the time and welcome our guests, and so you won't think we're crazy. But we just got back from an awesome seminar, we had to spend time with our CEO, and it was just absolutely amazing. We got to meet with our leaders in this company, and it was so powerful. It was so powerful. So I'm just excited, and others are as well. So it kind of excuse us a little bit if we get a little overboard, but that is why. But I'm just excited. And so at this time, we have our leaders that are on the call, and they're going to do their little 30-second readings. And we're going to start with Mr. Jacob. Good to see you, sir.
Hello, Sharon. It's good to be on the call tonight. I feel the spirit, Sharon. I didn't make it, but I felt the spirit all the way from Atlanta. It was so nice and so enticing. I just feel like we got a great thing going. I want to welcome those coming to the call tonight. Enjoy, put your seatbelt on. You're going to take some good notes and hear some great testimonies. Back to you, Sharon.
All right, thank you so much. All right, Miss KJ Jemison, Diamond Master, just give us a quick 30-second.
It was just wonderful to see everyone, and also Chairman, CEO, our leader, CEO. It was a wonderful message, that gospel that he spread out, and who won't be? We love him all. And back to you, Sharon.
All right, thank you so much. All right, Miss Sue Wren, let's hear from you real quick with that beautiful smile.
Sharon, thank you so much. It was such a pleasure to finally meet everybody in person. And I was so charged up, just like everybody. I loved the whole thing. I loved it from start to finish. I thought it was awesome, and it was just wonderful to see everybody and give y'all hugs and wish you well and love Atomy.
Awesome.
Thank you. Back to you, Sharon.
Oh, you're welcome. Thank you so much. Mon, Ari. Sales Master, go ahead.
Can you hear me?
Yes, I can hear you.
Okay, awesome. Thank you everybody for being on tonight. If you did not get to Atlanta, make sure you get with the person that was there. Ask them what have they learned, okay? And if you are there, and if you were there, I challenge you to call every downline that you have, call everybody that you know that did not get to Atlanta, and share with them what was the difference between this company and other company. If you have been in any other kind of network marketing business, it will blow your mind away. You will blow your business up if you just share the information with them. So Nice to you.
All right, thank you. We're gonna ask that you mute your phones as you come in. I need y'all to help me with this, okay? Great, great, great. All right, all right. Let me see, who am I missing? Any more sales masters? Patricia Hornsby, real quick. Ms. Hornsby, go ahead.
Thank you, Sharon. Good evening, everyone. My name is Patricia Hornsby, and I am from NC Global. And it is a pleasure to have you on tonight. So I will do and to be with you this evening. And I am very happy to and enjoying the information that you guys have shared and the great pictures that you shared. So, and everybody just hold on to your seatbelts, and we're about to take a ride. Back to you, Sharon.
Thank you. Thank you, Ms. Patricia Hornsby. I have my upline, Ms. Sunny Lovelace. Just greet us give us your 30-second commercial, Ms. Sunny Lovelace. We had
Hi,
so much.
everyone. It was great meeting to people. We miss the hunger to hug everybody just the last 3-4 years through the COVID, but nothing can stop our just the passion to Atomy and just care each other. It was wonderful seminar, and also just looking for tonight. Back to Sharon.
All right, thank you, Ms. Sunny. All right, one more person I want to get because she's so busy. I just want her to greet us, and that's Miss Eunice Hans, our Royal Master. All right, Miss Eunice, unmute.
Is it my time?
Yes, it's your time.
Yeah, I'm happy to see you all again. This success seminar seems to have been an opportunity for each of us to get what we really need. Through this opportunity, I think we should be ladies and gentlemen. And the patience and confidence we gained from the seminar will lead us to success. I hope the next seminar, success seminar, will bring more partners to give them the chance to feel what you feel and see what you see. I hope so. Thank you.
Thank you, Ms. Eunice, Royal Master. We appreciate you so very much, so very much. All right, Uncle Mike, I'm gonna ask you to introduce our speaker. I am super excited. I got to meet her. I got to take pictures, and it was just such an honor to meet her and to have her on stage, sharing her testimony with all 1,200 of us. I was so excited about that. So Uncle Mike, go ahead and introduce our speaker for tonight.
All right, thank you very much. All right, ladies and gentlemen, our speaker tonight, she is not new to this call. This, I think, is going to be about, I think, her 3rd time on. And every time we have her on, everyone loves her. She just brings so much knowledge. You know, not only does she bring the beauty, but she brings the knowledge. She's intelligent, and she shares, and we open it up for question and answer. So I'm not going to take up any of her time. I'm going to have her to let us know the different states that she is certified in. And ladies and gentlemen, let's give a warm welcome to Dr. Suzanna Dotson. Dr. Dotson, how are you doing?
I'm doing really well. Thank you, Uncle Mike. Thank you so much for that lovely introduction. It's Susanna. So all you have to do is remember that song, the old Southern song, Oh, Susanna. Yes, absolutely. It's a pleasure to be here with everyone. I was overjoyed, and it was a real honor to be able to speak to all the Atomians there. I was very moved, and I hope we can spread the message and share Atomy with more of our friends and family. All right, so I learned from the last time, so I'm going to share my screen with you, and I'll give myself a quick introduction for those of you who are unfamiliar, and then we'll get started. Let's see. Can you see my screen?
Not yet.
Not yet. Let me see. Share.
Okay, see it now.
How about now?
Yes.
Okay. All right. Good. So My name is Dr. Suzanna Dotson. I am a board certified family physician. I'm also, I practice hospital medicine, and I'm a locums hospitalist. So that's a fancy way of saying I'm a traveling doctor. I'm a traveling physician. As Uncle Mike said, I'm licensed in 6 states, and I travel to all of them to work in what we call remote critical access facilities. They are considered critical because they're in rural, remote areas where it's difficult to find providers, and there aren't any hospitals around for, like, hours, 3 to 4 hours drive. So that is my way of working as well as serving, being of service. I love to combining my desire for travel as well as my desire to serve.
Thank you, Ms. Holmes.
I'm also a clinical associate professor at the Orlando College of Osteopathic Medicine, where I instruct medical students and residents. And well, tonight's topic is on urinary tract infections. So I wanted to give a brief talk on this very important topic, and then how we can prevent it. So I have, so urinary tract infections, I'm going to refer to it from now on as UTIs for short. It's an infection of the kidneys or bladder or urethra, sometimes all 3 at once. Infectious cystitis is the common type of UTI, and which is caused by bacterial infection of the bladder. Sometimes you can get a more serious infection called pyelonephritis, which is an infection of the kidneys that the infection from the bladder works its way up. The other kind is a urethritis, which is an infection causing inflammation of the urethra, which is like the opening from your bladder to the outside. So UTIs are caused by bacterial overgrowth in your lower urinary tract. Most common pathogen is the E. coli, but there are others. Oh, it looks like my slide got cut off. There are other pathogens like Klebsiella, Proteus, group B, Streptococcus, lots of different pathogens or organisms, bacteria. So the question is, how do you know if you have a UTI, right? You have what we call dysuria. A lot of times you'll have burning with urination. You'll have pain just above, below your belly button, just above your pubis. You'll have urinary frequency, meaning you got to go to the bathroom a lot. And when you go, you get like scant amounts of urine each time. Sometimes you can have hematuria, which is blood in the urine. Again, with serious infections like pyelonephritis and sepsis, you can have fever, flank pain, which is like pain in your back and side. Sometimes the only symptom in older adults may be what we call altered mental status. They will have asymptomatic UTIs, and they will just be altered. They won't be in their right minds. We can talk about that in the question and answer session. So it is important to know that every symptom is not a UTI. So this is why it's important to come in and have your urine checked. It needs to go for testing. You can have overactive bladder, which give you a lot of the symptoms as a UTI. You can have something, like a non-infectious urethritis. So meaning, you have inflammation and a urethritis, but it's not bacterial and it's not treated with antibiotics. Sometimes, early bladder cancer symptoms mimic UTI symptoms. You can have dysuria and hematuria, blood in your urine. Sometimes you have a yeast infection or vaginitis due to candida or other types of fungal infections. So it's important not to treat that with the antibiotics, because if you treat a fungal infection with an antibiotic, it makes it worse. So that's why it's important to come in and get treated. I know a lot of times it's inconvenient. You just want to call your doctor's office and have them, just call in an antibiotic. But there are a lot of other things that we need to rule out and make sure. So what are some of the tests? So an easy test is a urine dipstick. A lot of times that can be done right in the office. You can do a urinalysis and urine microscopy where they look under the microscope and look for the infected cells. White blood cells, usually leukocytes. The other thing, the gold standard is you really need to do a urine culture and then also get sensitivities. That takes a little time because you have to grow the culture and to get the sensitivities, it takes at least 24 hours or longer. And that's important because you want to make sure you're treating the right bacteria with the right antibiotic. So all antibiotics don't treat all bacteria. And even in the same person, some people have resistance. Depends on the strain of the bacteria that you have. It may be resistant to one antibiotic and not the other. So it's important. Because otherwise, if you're just treated with one and it's ineffective, you've lost time, you are suffering, and also you are contributing to antibiotic resistance. Okay, so how do we treat it? Usually it's oral antibiotics. There are lots of different types of antibiotics. That's why the sensitivities are important and it will guide you. Also, we have to cross-reference that with your allergies, right? So it's important to check. When it gets serious and what we call it a complicated UTI, you may have to go in and get IV antibiotics. Sometimes it's really important to get it checked and treat it with the right one because it could lead to something called urosepsis. That means the urinary tract infection gets into your blood and you can become septic. And potentially, you can die from that. I'm not sure if you guys remember a few months ago, former President Bill Clinton was, admitted to the ICU. He had urosepsis. It can happen to anyone, but elderly people are particularly susceptible to urosepsis. Again, the standard of care is to do a culture and sensitivities, and sometimes, sometimes I will start you on a broad spectrum antibiotic until I get the sensitivities, and if it says something different, I may have to switch the antibiotics. But just to get you started and not to stop the suffering and pain, initially get started, I may start you on one and then change. So you have, these are some risk factors. We don't need to, we don't have to go into all of them. If you have any questions in the question and answer session, we can go over it. But sexual intercourse is really the strongest risk factor. And so that kind of puts, most adults at risk, men and women. Obviously, women get it more than men. And that has to do with our anatomy because of the vaginal opening, the anal opening, and the urethral opening are all very close in proximity. So there's a lot of opportunity for bacteria to cross-contaminate. So another risk factor is positive family history. So if your mother has had a history of frequent UTIs, you are at risk for that. History of a prior UTI for yours personally, will put you at increased risk for having another. A foreign body, that means, some people have an indwelling catheter, some people have to intermittent self-catheterization. If you have a kidney stone, if you have had some surgical mesh put into your body, there are a lot of those increase your risk for UTIs. Sometimes when you are diabetic and you're on certain medications, you're at increased risk for UTI because some of those medications, for lack of a better word, sweetens your urine because you're spilling lots of sugar in your urine, And so bacteria loves sugar. So just remember that. Foreign bodies are a nidus for UTI and other infections because it's a little culture. It's a nice medium for growth. They get their little clammy claws on that foreign body, and it accumulates, and then the colony grows. Okay, so UTIs in the elderly are particularly, it can be severe. It's very common. Part of the reason is that your immune system is compromised, right? As you get older, your immunity wane, your immune system is not as strong as before. You may have, depending on, if you're living in congregated settings, you're frequently in, nursing homes or hospitals, you have what we call nosocomial pathogens that you get from your environment. You have lots of other like comorbidities, meaning other medical conditions that make you more susceptible. And you're likely to have had a history of UTIs in the past. So like, unlike younger people, urinary tract infections, in older adults, sometimes very difficult to catch early because of the waning immunity. Sometimes you have what we call asymptomatic UTIs, meaning you don't have the symptoms. And by the time it does manifest, it usually manifests in, where you have altered mental status and you're uremic and you're uroseptic, and at a more advanced stage and more critical. So that it's important if you guys are caring for aging parents and they were fine one day and then the next day they're talking nonsense and gibberish, you definitely want to take them and rule out a UTI, take them to the doctor and get their urine checked. Okay. At the same time, physicians, we have to be stewards of, antibiotic stewardship, because while we want to make it quick and easy and treat you, we want to treat you properly without causing and contributing to multi-drug resistance to organisms. So if we just give you antibiotics for the wrong thing, for the wrong organism, it's really not helping. And then later, when you develop a resistance, you're not going to be able to use the antibiotics that's needed. Also, I cannot stress this enough. I cannot stress this enough. You are going to feel better probably after the first 1 or 2 days, but you have to complete the entire duration of therapy. Depending on the antibiotics, it can be 3 days, it can be 5 days, it can be 7 days, 10 days. It all depends on the pathogen and depends on the antibiotics that's selected. So whatever it is, you need to complete it. I know you feel better, but you're not helping yourself in the long run because you're subtherapeutically treating, and then you will probably have a rebound, or you're contributing to resistance for the future. So please, please, please. And also, this is not in my slide, but now I'm in my doctor mode. So please don't confuse an adverse reaction to antibiotics for an allergy. So most antibiotics will not agree with your stomach, right? Because in addition to killing the bad bacteria, it's also killing all the good bacteria in your GI tract. So of course, it may cause you to have loose stools or maybe even diarrhea, depending on how sensitive you are. It may cause you to have stomach cramps or just generally dyspepsia. That is not an allergy. So please don't say that it's an allergy, because then you're putting on your medical history. You're ruling out antibiotics that you may need in the future for something else. It's called an adverse reaction. And there are things that we do to symptomatically treat for that, but we have to weigh the risks and the benefits, right? So it's the benefit of treating the infection outweighs the adverse reaction, and so you kind of have to stick through it. And you can take Imodium, you can take other things to help treat whatever the symptoms you have, but you got to push through and complete the therapy. Okay, sorry about my tangent. But tonight we're here to talk about how we can prevent it, right? So one of the things that I recommend is the women's probiotic. I'm kind of, I wish it wasn't called the women's probiotic, because men can certainly take this, because the lactobacillus is in most humans and lots of other animals. So it is not specific for women. I think, it's targeted for women because you generally have more UTI than men, but men can definitely take it. Certainly elderly men and men who have urinary retention, who have prostate problems, all of those things contribute to urinary retention. That means you're keeping urine in your bladder longer than you should. When you void, you should be completely emptying your bladder. Sometimes, men with prostate problems, you don't completely void. So all the time there's like urine sitting in your bladder. That is what we call a nidus for infection. It's like a petri dish. It's the bacteria that normally is in that area. Now it has a place to sit and grow and multiply. Okay, so the women's probiotics has the cranberry extract, right? It has 100% Vicinia macrocarpin. And what's really beneficial about the Atomy probiotics is that it comes in Atomy probiotics is that it comes in I'm sorry, I'm getting a feedback, so I'm gonna try to push through. I'm specially engineered. I'm gonna try to push through. So it's specially engineered in a vial that protects against high temperatures and humidity, so that the probiotics is kept in therapeutic form, right? So because these are live cultures. This one has the one capsule has like 3 billion CFUs. Uncle Mike, is there something we can do about this?
Is it a possibility that there might be a cell phone speakerphone?
Is it a possibility that there might be a cell phone speakerphone?
Dr. Lewis, need to mute. Dr. Lewis.
Okay, we got it. We got it.
Okay, all right, I'm sorry about that. So I just want to reiterate how it's it's packaged in especially engineered packaging to protect it against temperatures and humidity, because these are live cultures that we're taking. So, and it's important for it to be in an active form. The one capsule has like 3 billion CFUs. CFUs are like colony forming units. So the higher it is, the better. So if you're out shopping, hopefully after this, you're never shopping for anything else. But when you're shopping probiotics and you want to see, how one is better than the other, it's by the number of CFUs. And also, sometimes you may have a high CFU, but you may only have 1 or 2 strains. The Atomy probiotics, the general one has like 9 or 10 or 12 different strains if you include the prebiotics. So that's important, because we don't just have one strain of lactobacillus in our bodies, in our intestinal tract. This Atomy's women's probiotics has it has a trademarked the Urex trademark strain of probiotics, which has a patent, and it's made, it has a patent from this CHR Hansen company. It's a Danish bioscience company. And you can go to nih.gov and there are and see the studies that was done on it to that allowed them to show its efficacy, right? So one of the things about supplements is, when it's not FDA approved, you don't know. So it's important that you get connected to a quality brand that has studies behind it and that has quality control, so that each and every time you're getting what it says is in there. So this is the information on the back of our probiotics, right? You can see that it has the Lactobacillus reuteri and the Lactobacillus rhamnosus. This is a little excerpt that I cut out from one of the NIH studies, right? It has a lot of kind of scientific words in it, but I wanted to bold the important ones because what you want to see, that it has antimicrobial activity, right? That means it kills bacteria. And it inhibits the colonization of pathogenic microbes. Remember, I was telling you about how sitting urine and foreign bodies are nidus for infection because the bacteria colonizes and grows. So this inhibits that colonization. It reduces the production of pro-inflammatory cytokines. I can come back later and talk to you. I do want to talk to you about your immune cascade. And these are elements that participate in your immune system and how it protects you. But it promotes regulatory T cell development and function. And T cells, like natural killer cells and CD4/8 cells, they're all involved in fighting foreign bacteria. Okay. So I don't want to bore you too much, but I always like to share this because the company wants you to share your personal experiences, right? And so there's no need to make a false and exaggerated, misleading statements, because the studies are the product speaks for itself in the way it works, efficacy, but also it's supported by scientific data. Okay, I'm gonna stop here, and that's it.
All right. Well, thank you very much, Dr. Dotson. Let's give her a warm welcome, everybody. Thank you. That was some good information. And we have a lot of people that have excellent testimonies from using this product. And if there's any that's on the call, we definitely want you to share it. So what we're going to do at this point is, Sharon, are we going to have, do you have testimony set up, or do you want to go straight into Q&A?
Let's do one quick testimony. I want to ask Jan Britton to share her testimony, and then we'll go to questions and give people time to get their questions together. Okay.
Good evening, everyone. And it's always good to see everyone here, and I appreciate it. Thank you so much. And also, it was really pleasure to see at the Success Academy, especially Uncle Mike. Thank you. Okay. Thank you, Dr. Dotson. The reason, and I really like to tell this story, like I had it before previously, very, very seldom, like sometime every other month, sometime every 3 months, I had this UTI. And whenever I ask Dr. Dotson, she said, Lani, I didn't want to give you a wrong one, so please come in. And she always just tell me that. And now I know why more specifically she tell me this, okay? And it's the funniest thing I did, and like 1 or twice I asked her, she said, look, I didn't want to give you a wrong one. Each time it could be different symptom, So And I really appreciated Dr. Dotson, especially what you told me this tonight. I even believe it more than anything. Why? Because now I follow what she told me, and now I haven't had this. It's about like what, Dr. Dotson, almost like 1 year, right? I didn't ask for her for prescription or anything. She told me to take it. Woman probiotic is really good, and plus saw palmetto. Yes, so I do take it this both. So now I didn't have this for like almost 1 year. So I wish everyone have like this kind of experience as I had it. And thank you, doctor, for your advice and your prescription before I had, oh my God, it's like horrible. Thank you.
Awesome.
All right.
Thank you
Thank
so
you very
much.
much. Yes.
Okay, Uncle Mike, let's get these questions.
Okay, we're going to get the Q&A. And before we start, I just want to say again to Dr. Suzanna Dotson that, we are really blessed to have you as a part of Atomy, and we appreciate the information that you share. Thank you again. All right, just raise your hand, and when you come on, please give us your name and tell us where you're from. Any questions for Dr. Dotson?
Yes, we have Christopher with his hand up. Go ahead, sir.
Good evening, everybody. Christopher Griffin, fabulous start, Vegas, Mississippi. The question I have, Dr. Dotson, is when men, I didn't know men even got UTIs, but when men do, is it treated anywhere close to what you would do for women? And is it any different as far as the severity in men than it is with women?
Okay, so in terms of treatment, no, it's not treated any different because it's going to require a urine culture, urinalysis, urine culture, and we treat it with antibiotics, right? There are few occasions when it is a fungal UTI, right? So again, it's important to get this culture and sensitivities, but usually that it depends on your immune status. That's usually reserved for immunocompromised people, but it is possible to get a non-bacterial UTI and it can be fungal, but most for men and women it's treated with antibiotics. In terms of the symptoms, some uncircumcised men are a little bit more increased risk for having a UTI, but really men generally have it because of prostate issues, because of the urinary retention, and usually it's stones, kidney stones. Well, women can have it too, but men, you guys don't like to drink water. You need to drink water, That's how you prevent kidney stones, which often will cause blockage, right? The kidneys form, the stones form in your kidneys, and then it has to travel down your urethra, right? Your ureters, which connect your kidneys to your bladder, and then your urethra, which connects your bladder to the outside. So sometimes, depending on the size of those stones, it gets caught and causes retention. The urine can't get past it. I hope that answers your question, but you treat it with antibiotics just like women, and your symptoms are generally the same, but you may have more mild, or you generally don't have the itching or the burning, but you will have pain and the frequency, like you go to the bathroom a lot, but you're not completely emptying.
Okay. Does saw palmetto for us help with that in any way?
So the saw palmetto helps. The reason I tell people to take it together is the saw palmetto will help with the prostate issue, right? So it not only does it help to relax the smooth muscle that surrounds the prostate. I don't know, I'm on a different screen than my voice. So if you can find me, maybe you can see me. I'm demonstrating, but your prostate surrounds your urethra, and when it enlarges, it squeezes tightly onto the your urethra, right? And so by taking the saw palmetto, it helps to shrink your prostate so that it's not pushing and narrowing your urethral tract. Does that make sense?
Absolutely.
Okay.
Yes, makes perfect sense.
All right, David, go ahead. You have your hand raised.
Yes, thank you, Sharon. Dr. Dotson, I did not have an issue with UTIs, but I did have sepsis. And
Sepsis?
one time I had something they call rigors. And of course, I was a dialysis patient. And so my infection, they believe, came from my access to my dialysis access. But anyway, long story short, what I was trying to get to, since I was, well, May of this year, I had a kidney transplant, and everything seems to be going really well. But my concern, as I was listening to your presentation, you know, after I had the transplant, my bladder had to adjust to the being utilized again, since I was not urinating while I was on dialysis. But since the transplant, everything is working fine. But I'm just curious. I had 2 pediatric kidneys, and of course the surgeons explained that the kidneys has to grow and they'll continue to develop and do all the functions that the kidney's supposed to do. But my concern was the bladder. I did experience what they call bladder spasms at the beginning when I started to urinate again. But since then, I've had no problems. But my question centers around the should I use something like the women probiotic for preventive measure, since I don't know if my bladder is at full functioning or if they're completely empty. Now, as far as when I go to the bathroom, I feel like it's emptied out. And so my question is, should I try the women probiotic just for precautions?
Absolutely. That's what I was saying. I'm kind of disappointed that they named it women's probiotics, because it's for anybody. You can those 2 strains, obviously it's specifically formulated for the urinary tract, but you find those bacteria in your GI tract as well, and in other parts of your body. So it's not just you literally have that. This is going to boost it, right? So it is, yes. So the short answer is yes, especially if you're vulnerable, right? And because of your transplant and the immunosuppressives that you are receiving, you are at increased risk. So I would definitely do the preventive, take it for preventive measures.
Awesome. Okay, you're muted, David. David, you're muted.
Okay, the pharmaceutical team at the hospital, the first thing they tell you after transplant is, don't use herbs or anything like this, because, your immune system is put in a compromising state to prevent the rejections. I get that, but I kind of been trying I'm still using the HemoHim. I'm using products that boost the immune system, but I don't want to overdo it. So I guess that's what my concern is, and I really don't get help from the the transplant team. They always tell me bring the product and let them research it, but I just feel comfortable using the products, maybe at a less amount than the prescription, but I just know that these products has made a tremendous difference in my energy level since I had that transplant. But this, I think, is something that I will be adding to my regimen.
And I definitely, I appreciate your transplant team because of, sometimes people go overboard thinking if they, if one is good,
Yeah.
4 is better. So that's what they don't want you to do. But if you're doing it under the guidance of, and supervision of a doctor or someone, I think you're fine in your particular case. For the, everyone else with a normal immune system, the dose that is recommended for, for daily prevention, it's nominal, that it will not hurt your, if you've got normal working kidneys, it can definitely handle that load.
Got it. Thank you.
Awesome. All right. Thank you, David. Now I have a quick question. I have a customer who's dealing with herpes. Can this be something that can help her?
No, I mean, herpes is a virus. So
Okay.
it's not going to treat that.
It's not. Okay. All righty. All right. Anyone else? Okay, Uncle Mike, do you think you could give us, okay, go ahead, Mon.
Thank you. Hey, everybody, this is Mon, Cheryl Master for MC Global. Just want to say thank you, Dr. Dotson. It was a pleasure meeting you in person in Atlanta. It was amazing. Of course, so many people that were there. Your presentation today was amazing. I have never, thought about that, and we did talk about that, and I did talk about it, see if what it would be like for guys to take it. And I was like, I don't know. I might not. But from your presentation here, I will try it out. Of course, we all know who was there at the Success Academy. If you were there at Success Academy, you paid $40 for tickets, right? But what you get from it was that gift right there. That gift was $45 in itself. And the hand sanitizer, you got that as a gift, right? And guess what else we got? We got dinner, right? Dinner, the hotel dinner was $70 to $75 per person. So you only pay $40 to get all the training, to meet all the amazing leaders, to see all the stories, to see all the successful people. If they can do it, you can do it. Get to see our CEO, Mr. Hankiel Park, in person. Take a picture with him. If you were there and you did not have a chance to take a picture with him, I don't know what you were doing, because everybody was looking for him everywhere. So again, Dr. Dotson, thank you so much for the presentation. I will be using my free gift, my women's probiotics. Thank you. Back to you.
Wow, that was amazing. Let me just add that this week, Friday and Saturday, was such a blessing. So Friday we had a Bible study. The company put together an awesome Bible study. And listen, we were downtown Atlanta at the Marriott Marquis, and the company paid for our total room. Okay, didn't have to pay a dime. And I was on the 40th floor looking in the clouds, but it was amazing. And how they really took care of us. And so guys, this company is absolutely an amazing company. And I just know for me, it's Atomy all the way. Not because of just what the company has done, but what the products are doing for our people. And so, ladies and gentlemen, we thank all of our guests for being on the line. If you're coming in for the first time and hearing, we have doctors that are on this call that share information because we don't know. You know, we didn't go to law school. We didn't go to become a doctor or anything like that. Some of y'all did. So they're able to share information with us. And this is what this call is about. And so we're just grateful for all of our leaders on the call. And Uncle Mike, I'm going to give you a few minutes to close out and to share what you have. Keith has a quick question. Go ahead, Keith. Keith.
Okay.
Yeah.
Thank you, Dr. Dotson, for everything. And I want to say when we were down there, I got bus left, and they got me another room, and got me a ride back home. And mine had me get bus left. But I want to one more thing I want to say. I went to the doctor today, and she checked my blood pressure. And she said it was good, real good. I said, well, do I need to take the medicine? She said, no, you don't need to take any more medicine. I said, I hadn't been taking it. She said, why you hadn't been taking it? I said, well, I ran out and I was taking this thing called Him on Him. And it's keeping it down. She said, what is that? And I told her what it was, and she got online and looking it up and everything. She said, well, you don't have to take the medicine anymore. So, you know.
Wow.
Yeah.
Wow. That's huge. Oh my God.
Yeah.
So the products are working. Do y'all agree? Give me a thumbs up or a sign. Do y'all agree that the products are working for you? Absolutely.
Yes.
Absolutely. So listen, just try the products. If you're new, get on these products, get back to the person that invited you on this call and get on these products because we got to preserve ourselves, right? So I don't know about you. I plan to live 100 unless the Lord say differently, but I'm going to live a long time because of these products. All right. So Uncle Mike, I'm a hush. I'm excited, as you can see.
Yeah, thank you very much. And I wanted to add something. You know what? Mon had gave us all of those prices of what the company paid for, but there was one thing that Mon forgot to mention, and that is that the company paid for parking. Listen, ladies and gentlemen, parking was $55 a night. Okay. So they paid for my parking for Friday and Saturday. All right. So that's $110. So the value, you can't outgive Atomy. Okay. And we see that in so many different things. I want to just add something or just bring out something. Dr. Dotson, she did such a great job. I want you all to see this, and it's on your site. It says, what is Urix? Can you all see that?
Yes.
Okay. And it says scientifically documented 2-strand solution for vaginal health. Okay. Christian Hansen is a Danish company with years of experience in formulating quality products with superior stability. Urix is a result of over 35 years of Christian Hansen's research, studies, and findings. Ladies and gentlemen, that is strong, okay? And I'm just so happy that they came out with this product, something that can help women. And now with what Dr. Dotson has shared with us, that men can benefit from it as well. So ladies and gentlemen, especially for those of you who are new, let me tell you something. You're in the right place. You're with the right company at the right time. Just stay plugged in and don't quit. All right. Once again, we want to thank Dr. Dotson. Outstanding job, good information. And ladies and gentlemen, every Tuesday night, bring your family and friends to this call because we've had like 4 different doctors on in like the last 4 to 5 weeks. Okay, so we're really getting a lot of good information. Plus, we have people like Sales Master Sue Rue that talks about, you know, that our wonderful product, the Pomegranate Beauty, and brought to our knowledge a word oxymantia. Listen, ladies and gentlemen, you get a lot of good information from these calls. I am telling you. So, you know, always utilize this. This is a way that you can build your Atomy business just by bringing the people on. You don't have to have all the information, but you know where to go get it. So bring your people here share it, and I'm going to tell you, we're going to have a good time. Are there any other closing questions? We may have time for one more. If there is one, we're going to end on time.
Yeah.
Yes, Mary Lou.
Yeah, I have a question for Doctor. But before that, I would like to thank her for being our speaker tonight. And I was so lucky that I saw Dr. Dotson last Saturday. Yeah, I was seated at the back of Dr. Dotson, and I love her presentation. We're proud of you, Doctor. You know what? I was told my friends, my consumer, that, oh, we have a doctor in our Atomy company. So my question now is, when I sleep, like after 1 o'clock or 3 o'clock, I have to get up to pee. So that's why I'm wondering if what is the best time for me to take the women's probiotic so that I will just sleep so up until morning, so I don't have to wake up to pee. And is it okay that I will also take the Sopalmido with it? That's my question. Thank you.
Yes, I recommend the saw palmetto again for the same reasons of you want to try to prevent urinary retention, right? The reason what's happening to you is called nocturia. There are a lot of reasons for that. It means you got to go to the bathroom frequently at night. We have to first find out what the cause is for that. Is there a lot of different reasons? It's not always just a UTI, right? It could be, you may have urinary urgency, and that has to do with the neurological thing with your detrusor muscles. Could be that you're drinking too late, right? You have to bladder train yourself so that if you continue to wake up, you want to make sure you complete your drinking your water by a certain time so that you can sleep through the night. So, I don't want to tell you that taking this is going to cure your nocturia unless, it is caused by some mild cystitis or urethritis, right? It depends on what the cause is. So first we need to make sure that we know what it is.
Awesome.
But Doc, if you don't have UTI, we don't need to take this women probiotic or any. Is that correct?
Well, this is to prevent it, right?
Oh,
it's not treatment for it. It's wholly insufficient for treatment. This is for prevention.
Okay.
Not for treatment. Yeah,
Thank
absolutely.
you.
And just because you gave introduced this topic, I just want to say one of the other common reasons that lots of women, especially middle-aged women, have UTI symptoms. It's from menopause, being postmenopausal, having less estrogen, and it's from what we call vaginal atrophy. So you have irritation and symptoms that are similar to a UTI, but it's not a UTI. It's from postmenopausal vaginal atrophy. Okay.
Okay. All right. Well, thank you once again, everyone, for your questions. Thank you again, Dr. Dotson. We're going to close out with the company motto. And don't forget the Sunday night call, North Carolina Global at 7:30 Eastern. Most of you all know about it. If you do not, just get with someone on the call and they can get that information. Okay, with that being said, everybody unmute. We're going to do the closing motto. We want to thank all of our leaders for being here tonight, especially our Royal Master Eunice. So good to see you on the call. Okay, with that being said, I just have one question. Company motto, are you ready?
Yes.
Oh,
Cherish the spirit, keep the vision, fight the faith, humanity, Aja, guys.
Dotson, thank
You,
you.
everyone.
everybody have a great
Thank you so very much. Thank you. Thank you, Dr. Dotson. Thank you.
Soon again.
See you.
Right. Thank you so much. Oh
Thank
my
you.
God.